Well, in some excellent news for Queensland today, can I say that we have had 0 overnight cases. Well done, Queensland. And this is exactly the hard work of everybody that's getting us to this point. But of course, we know that we're still not out of the woods yet, but I'm so pleased that we have got 0 cases today. That means our active cases are 25, our total confirmed cases are 1,128, and in the last 24 hours, we have had 13,778 tests. So once again, a big thank you to everybody who's gone out there and been tested. So of course we have our specialist care unit that will go live today. We understand that of course this is a very, very difficult time for families. I know that, people know that, and we want to make sure that if people in northern New South Wales need to get to those specialist appointments, we have a special dedicated unit that will be there for them. That will go live today. There is a team of 8 specialists that will involve doctors, nurses, paramedics, and also social workers, because this is often a distressing time for people. I know that. My government knows that. And we are here to help people during this critical time. In total, in the unit for exemptions, we have a team of 80 people working on this. So this is about the government working in the best interests of families during these very difficult times. We did not cause this pandemic. This is a world pandemic. No one asked for this. We know that families are not seeing each other at the moment. There are international borders up. Scott Morrison has put out that is going to be extended for another 3 months. So families are not going to be united for Christmas, and that is going to be very tough on families. And we know it's going to be tough on families over the next few months because we are in this global pandemic. The other issue I just wanted to address before handing over to Dr. Young is that we've had some concerns about borders going to Moree. And of course we want to make sure that we are putting the best interests of these young people front and centre. And that is why we will be adding Moree to our travel bubble. This is going to be great news for those families to ensure that they can be home for school holidays. Yes, boarding school students, yes. So I'm happy to hand over to Dr. Young, and then we'll take some questions. Thanks, Dr. Young.
So we're now 8 months into this pandemic, and we unfortunately know we've got quite a while to go, but here in Queensland we do have it under control. So no new cases overnight is excellent. So at the moment we have 30 cases related to that cluster. That's the cluster with the Brisbane Youth Detention Centre and the cluster with the Training Academy. And we've been working through that to make sure that we didn't get chains of transmission related to either of those clusters. We're now down to 25 active cases, so we've already seen people from those clusters have their disease and get better and resolve, which is really good. We need to keep that going. So I know that those restrictions are difficult for those aged care facilities in particular, but they are so important. So we'll be keeping a very, very close eye on that aged care facility at Laidley. The staff there, with the support of the Westmoreton Hospital and Health Service, did a fantastic job, and we hope with all of that work that none of those residents will get COVID-19, because we know that our residents who live in aged care are the most vulnerable residents. And we've now had, each time we have a cluster of cases, we have one aged care facility involved, and that's where we have to focus so much of our attention. That is critical. So I am very sorry that people can't go and visit their relatives in aged care homes when something like this happens, but it's just vital that we keep those people safe, because unfortunately we have seen that once it gets into an aged care facility, you do see deaths. So that's tragic. So I ask people just to be patient a bit longer, and we will open those facilities to visitors again as soon as we possibly can. So today is the first day of 0 cases related to those 2 clusters. We just need to follow that going forward. Then a few other things. I've been working very, very closely with my counterpart in New South Wales, and we've been sharing a lot of information. And with that information, I'm very confident that Moree is a safe place to add into our border zone that we're looking at for New South Wales. And we know that's particularly important. I went and looked into it in great detail because unfortunately when that supermarket burnt down, they didn't have a lot of options. They of course could travel into Queensland, but the distances, if you look at them, it would be quicker for them to travel down into Moree. So for a number of reasons, but the most important reason of all, of course, is that it is safe for us to do that. So Moree will be included in the New South Wales border zone going forwards. Remembering, of course, that this could change, but at this point in time, New South Wales does have control of their outbreak, and they've been able to limit it to other parts of New South Wales. The risk, of course, is that people in those other parts can travel up into the northern part of New South Wales, but I discuss that risk every single day with my counterpart in New South Wales, and I know what is happening, and they're very proactive in sorting that through. So that's really important for us. Then I did want to mention to make sure that people understand that this is in place. Last week we treated 900 New South Wales residents in our hospitals in Queensland along the border. We are continuing to provide essential and emergency health care to people who live in northern New South Wales because we've always done that. Traditionally, Queensland provides that care. There has been no change to that. Whatever people may hear or learn about, that has not changed. So that's why we've stood up that specialist unit to make sure that people, if they don't know, that they immediately seek advice and they don't delay that necessary and essential health care. Well, I am in the health business. I'm the Chief Health Officer, so of course I'm always going to make sure that people can get the health care they need, and they are getting it. And I assure every Queenslander that, of course, you're getting good, solid, safe health care, and we are providing health care in a very, very safe way to people from northern New South Wales. Our hospitals are managing those people, so there is no risk to anyone else who comes to any of our facilities. So that's very important as well. So I also wanted to mention the fantastic work that's been done by Queenslanders throughout the state coming forward to get tested if they're unwell. We're seeing every single day around 10,000 Queenslanders come forward, and that is just critical. We always, I've said this many times, we have to find the first case in a cluster, not the 30th case. It's the first case because then we can stop that chain of transmission so we don't get more and more cases. So please just keep coming forward. Any symptoms you would have seen recently, we've got people with unusual symptoms, a bit of abdominal pain. So any symptom, please come forward and get tested. You don't need to come forward and get tested if you have no symptoms. If you are perfectly well, unless a health officer asks you to get tested because you're in a high-risk cohort, you're in one of those aged care facilities or one of those outbreaks, you do not need to come forward and get tested if you are perfectly well. But any symptom at all or any fever, it's really important to come forward and get tested. Thank you. That I'm still concerned about the number of cases that are occurring every single day in both Victoria and New South Wales. Although we're seeing some encouraging signs of those numbers reducing, there are still too many cases, I believe, for us to be able to safely open the border between Queensland, New South Wales, Victoria and ACT, because we know, unfortunately, that one case can immediately lead to a lot of cases. I still believe, although we didn't have definitive evidence, I still believe that it was that Melbourne cluster that led to the most recent 2 clusters. So we've gone from 3 people who returned from Melbourne to now 35 in those 3 clusters. So we can't afford to have a single case. If a single case comes from New South Wales or Victoria and they go into a high-risk setting like an aged care facility, we could immediately have an outbreak and we could have deaths. So we really have to be careful. If we look at the rest of the country, there aren't cases. So it's fine for our borders to be open to the rest of the country, although I notice that, of course, some borders are closed still to Queensland.
Sorry, just on the AFL hotel that's causing all the controversy, could anyone book a whole hotel out if they had the means, rather than going into the hotel, single room?
We've done that where we've got some COVID safe plans. So we have similar arrangements in place for agriculture, that we have people who are quarantining on farm or in agricultural colleges because we need to keep our agricultural industry going. We've got similar arrangements for our resources in mining. We've got they're all different. I mean, every single arrangement is done fit for purpose so we can keep that industry going. Now, in terms specifically of the AFL, this is what we agreed to at national discussions at AHPPC in terms of setting up hubs. So that was the agreement, that people could travel across borders associated with not only the AFL but the NRL and for some other sports, as long as they kept together in that bubble. And you might have seen where there have been breaches, those codes have been absolutely right on top of it immediately. So they've managed this very, very well. So yes, depending what the industry is and what the benefit to Queensland is, because we're all about trying to keep our economy going as much as it can, but being safe. Our first priority has always got to be about the safety and the health response, because if we don't have that, you can't have any of these other things.
Given what Dr. Young said about the other states, I'm assuming we won't be backing down on the national capital today.
Well, my understanding is that there's no decisions that are being made today. It's a discussion, but I think Queensland has done extremely well by relying on the expert health advice of Dr. Young. And let me make it very clear, I will not be changing that course anytime soon, because you have seen the great results that have been occurring in Queensland.
Given the pile-on that Queensland and you in particular have received over the last 24, 48 hours, do you feel it's a form of bullying against Queensland in this state?
I'll let others make comment about that, but can I thank Queenslanders? I have been, I'm really overwhelmed with the number of emails that have been coming into the office, personally handwritten cards. That's what keeps me going.
Has it been unfair?
Once again, that's for others to judge and for them to make up their minds. But I get up every day and I rely on the best health advice to look after this state.
Sorry.
Well, I reject that, because we have the best interests of the public and the community at heart. I've just been up in Cairns. I spent 2.5 days up there, going around meeting people, talking to people, and I'm just absolutely overwhelmed by the number of people coming up and just saying thank you for keeping us safe.
Premier, what do you say to people then who think we need to get to a point where we learn to live with the virus?
Well, the Deputy Chief Health Officer came out and said the aim was no community transmission. That's what the Deputy National Chief Health Officer said. And we have seen that happen in other states and territories. And my focus has always been, as a country, we should be focused on the risk areas, and that is Victoria and New South Wales. And we should be putting all of our energies into that. Now, let me also just say this. There has been a federal court case that has said the states have a right to put in place border measures because if the virus is allowed in, it poses a huge risk to the community. That's a federal court decision that has backed in what the states are doing. So I think it's a bit disingenuous for this heightened criticism that is coming from a whole lot of levels when our fundamental concern is to look after Queenslanders and to make sure that they are safe during this time. And as Dr. Young said, there is a high risk when there is an outbreak of it going into our aged care homes. I do not want to see what has happened in our aged care sector in New South Wales and in Victoria happen here in Queensland. That would be a nightmare. These are people's families. They are their uncles, their aunts, their mothers, their fathers, their grandparents. I don't want to see that here, and Queenslanders don't want to see that here.
Do you think have you misjudged the public mood on the AFL Grand Final given the uproar over this 400 entourage?
Patrick, let me say this. Whoever won that Grand Final would have had the exact same restrictions put in place. If it had been New South Wales, if it had been South Australia, if it had been Western Australia, these were national agreements agreed by the National Cabinet and the health professionals. So, you know, it's almost as if we're being singled out because we won it. I mean, the economic benefit to Queensland is enormous.
The announcement today...
And isn't it, like, can I just finish, sorry? There are other parts of the world where there is no sport happening. There is no business happening, right? This is in Queensland because we are focused on the health response. Our economy is able to do better than in other states. Look at the state final demand the other day. The states that had border measures in place did better than other states. And you only have to look at South Australia and Queensland for that, and Western Australia.
This criticism, aren't you? This point's well.
It is relentless. It is intimidating, but I will not be intimidated.
What's sort of a personal 18 months from now? We know that unfortunately we're still going to be probably without a vaccine and we'll be subject to future border restrictions as well. But so far, this round of border restrictions have been different to the first round. Can you just clarify, are these restrictions going to be different every time? Or are you working towards a framework, for example, that would ensure a streamlined process for every time there needs to be?
Well, I think I answered the question previously by saying if we all focused our efforts on Victoria and New South Wales and getting the community transmission under control, right, to the extent that there was no community transmission, and that is the advice of the Deputy Health Officer of the country. That is the aim. They moved from elimination to suppression to no community transmission. If we focus on that, then there will come a time when everybody could open up.
I think it's clean up your own backyard before you start turning up the Queensland.
Well, exactly. I think, Victoria and New South Wales need to get everything under control then, and then the whole country can open up. It's a very simple... Sorry? Well, the ACT is part of New South Wales and Victoria.
Sorry, the decision today on the Moree, that's going to be welcomed by that town without the supermarket. But doesn't that show you need a national approach because you've got a Queensland decision ruling on New South Wales?
What we have is the chief health officers. See, I think what people are forgetting here is the chief health officers speak regularly and they work through these issues. There is a lot of work that happens behind the scenes that the public don't see. Okay, and as Dr. Young was saying, hundreds of people from northern New South Wales are getting the treatment they need at our hospitals. But sorry? Yes?
Oh, sorry. You mentioned before that these attacks have been relentless. What sort of a personal toll would that take?
I get out of bed every day and do my job, but my family are very upset. But, I just tell them to hang in there.
Also, Glasgow particularly described that benchmark to reopen the borders as a pretty tall order. Do you agree with that? What do you make of that?
Look, that's a matter for her, but what I said very clearly is if we as a nation can focus on Victoria and New South Wales and get everything under control then the whole country can open up. And I don't think anyone would be against that. I don't think you'd hear criticism from anyone about that.
It's a pretty tall order to get that community transmission under control in Victoria and New South Wales, isn't it?
But that's what the Deputy Chief Health Officer said publicly.
The New South Wales Premier also gets the free movement of all farm workers.
We already have exemptions in place for our agricultural workers. It's been in place since the 22nd of August. We have worked thoroughly through those issues. So I don't know what they're talking about.
Just on the AFL, can I just ask you one question?
Yeah, sure.
Just, no one wants the league shut down. The players have actually been up here for months. It's this arrival of 400 officials that's really caused, a lot of anger, really, and all questions this week. How would you explain, how is it fair for those AFL officials to quarantine, mingling together by a pool, while everyone else quarantines in a hotel?
Because they have put in place a plan, and that plan has been nationally accepted. If South Australia had won the right to host the grand final, the exact same things, as my understanding, would have applied there. So it was a national benchmark.
Well, perhaps Dr. Young could explain just how is that quarantine when they're mingling together at the pool? Why can't people in hotel quarantine here? Why can't they mingle?
Well, I'll hand over to Dr. Young, but we do have to get prepared for National Cabinet, so we might make that the last question, okay? Thanks, Dr. Young.
Could you just explain how that works as quarantine?
Yeah.
They're all mingling together.
Of course
you don't
they
have
are.
people in hotel quarantine.
Can I answer? Yeah. So the reason is that they have been mingling in Victoria, so they can continue to mingle here and they wear the risk. So if one of them becomes positive, so they're getting regularly tested as per the protocol. If one of them becomes positive, then they're all into individual quarantine. So that's the process. Whereas you wouldn't want that in another hotel. So we've got 24 hotels in Queensland that we're quarantining people in, and people come in on different days. So you'll have 300 today and then 300 tomorrow. So if they were all to mingle and one of them become positive, as happens fairly regularly, then that entire hotel would be shut down, everyone in it, for another 14 days. So you'd have people who were due to be released that day, who all of a sudden would be kept there for another 14 days. Whereas all of these people have come in together, they'll get regularly tested, and then on day 14, if no one's been positive, then they can all leave that quarantine. So it's a totally different situation.
What about hotel staff at that hotel? Are they allowed to go home each night, or are they quarantined?
They are not mingling with the hotel staff, so the hotel staff provide the food and then leave them to that. So there is no mingling between those people who are in quarantine and any of the hotel staff. That's part. You could probably go on and look at the protocol that was agreed by the AFL right at the start, and that's all documented. Sorry.